Peter, Jill and Brian are all living with a life-limiting illness, and symptoms such as fatigue and weight loss have a significant impact on their lives. At the Adelaide Community Health Service, we use the Cachexia and Fatigue Management Programme to better manage fatigue associated with chronic illnesses such as cancer and other life-limiting diseases. Cachexia is the term we use to describe a weakened condition of body or mind resulting from a chronic disease. In this DVD, we'll demonstrate how a combination of dietary supplements and resistance exercise can break the inflammatory response cycle and aid you in rebuilding muscle, leading to a decrease in fatigue levels. Chapter 1: Nutrition. Angie Hill will overview the importance of nutrition in advanced disease.
I am going to explain how fish oils can reduce inflammation in your body and how to include extra protein to limit any loss of muscle tissue. Together, along with resistance exercise, these two dietary strategies have been shown to help reduce the fatigue and weight loss of cachexia. We'll start with fish oils. Fish oil contains fatty acids called EPA and DHA, commonly known as omega-3 fatty acids. The EPA found in fish oils has a powerful anti-inflammatory effect. The recommended intake of EPA from fish oils to reduce inflammation is 1.4 to 2 grams per day. This can be achieved in several different ways depending on your particular needs. Fresh or tinned oily fish such as salmon, sardines and mackerel are an excellent source of EPA. To get the recommended anti-inflammatory dose of EPA, you would need to have around 150 to 200 grams of oily fish per day. For many people, this is not realistic or preferable. However, including a 150 to 200 gram serve of oily fish 2 or 3 times per week can often be achieved and can be supplemented with bottled fish oil, capsules, or omega-3 enriched supermarket products. If you are using bottled fish oil, you will need to take 8 to 11 mils of oil to get the 1.4 to 2 grams of EPA that you need to reduce inflammation. This is equal to taking 2 teaspoons of regular strength fish oil. Many people take bottled fish oil with juice or cordial to mask any unpleasant taste or smell, and some bottled fish oils now come in a fruit-flavoured liquid. You can experiment until you find a method that suits you. If you don't like taking bottled fish oil, consider taking fish oil capsules instead. Capsules are more expensive, but are preferable for those who find bottled oil unpleasant. You will need 8 to 11 capsules to obtain the anti-inflammatory dose of 1.4 to 2 grams of EPA. The good news is there are also now some concentrated fish oil products on the market that allow you to get the recommended amount of EPA in only half the dose. Fish oil capsules and liquid are readily available in pharmacies, supermarkets and health food stores. There are also some food products in the supermarket that have been enriched with EPA. Some of these include fresh, frozen and packaged fish and seafood, bread, yogurt, milk, juice and eggs, and lean red meat is a source of long-chain omega-3s. It is important to check the nutrition information panel on the product label to ensure the product contains EPA. There is no need to stick to just one method to get to your EPA. You could combine several different sources over the week to achieve the recommended dose. In order to feel the benefit of the EPA, you will need to achieve the recommended level of intake each day for at least 4 weeks. This gives your body time to incorporate the EPA into your body's cells. Now let's talk about the other dietary strategies, such as getting enough protein. When you're losing both muscle and body fat, such as when you have cachexia, it is important that you ensure that the foods you eat are rich in the protein that can be used to rebuild muscle. Proteins are made up of amino acids. When we eat protein, it is broken down into these amino acids, and these can be used to build and repair the protein structures of our body, such as muscle, bones, skin, blood cells and immune cells. Usually our protein requirements are easily met by eating everyday foods. However, if you're having difficulty eating, have a poor appetite, or are suffering from cachexia, it can be difficult to get enough protein to prevent this loss of lean muscle tissue. For people who are experiencing muscle wasting, their protein requirement can be almost double what it usually is, making it even harder to achieve an adequate intake. The recommended amount of protein for adults is around 0.8 to 1 grams per kilogram of body weight each day. But when significant muscle loss has occurred due to cachexia, the recommended intake is at least 1.4 grams per kilogram per day. For example, if a person weighs 60 kilograms, they would need to have at least 60 times 1.4, which equals 84 grams of protein per day. High quality protein is most abundant in foods such as meat, poultry, fish, eggs and dairy products, legumes, nuts and seeds. For some people who are ill, getting enough protein with everyday foods is too difficult. If this is the case, there are many nutritional supplements that can be added to your diet to make up the shortfall, such as Sustagen, milk powder, skim milk powder and whey powder. These products are an excellent and easy way to boost your protein intake and can be added to many everyday foods and drinks. Whey powder is a protein-rich substance that comes from milk. Whey powder may be especially useful as it contains amino acids that are very easily and rapidly absorbed by the body and can be particularly effective at promoting muscle building and repair after exercises. Simple whey powder has the added benefit of being okay to add to savoury meals such as soups and stews, as whey does not have a milky quality. It can be added to most foods to increase their protein content. Whey-based nutritional supplement powders contain concentrated whey protein. There are many whey-based nutritional supplement powders available now in supermarkets, health food stores and pharmacies that contain added vitamins and minerals and that can be mixed with milk or water to create a high protein drink. These products are often marketed to people who want to build muscle bulk due to whey's ability to promote post-exercise muscle repair. These whey-based supplements have as much as 6.5 grams of protein per tablespoon of powder. As with fish oils, the best solution is often a combination of foods, supplement drinks and powders that fit with your tastes and symptoms.
Chapter 2: Guidelines to Resistance-Based Exercises. Sue Tulloch, our physiotherapist, will give you an overview of resistance-based exercises.
I'm going to explain how to build muscle strength through resistance exercises. When done regularly, exercise has a positive effect on the body's immune system, as well as decreasing inflammation. To build muscle strength, we recommend progressive resistance-based exercises. This type of exercise works the muscle against a load, using small weights or the weight of your body. There are 6 basic exercises recommended. Get some advice from the physiotherapist if you have trouble with any of them. As the name suggests, these exercises are progressed by increasing the light weights that are used. We want the muscle to feel challenged by the exercise, but able to do the required movement in good form, with slow, smooth control. When you do the exercises, keep in mind these guidelines. Do not do the exercises every day. A rest day between the exercises is important. Aim for 3 times a week, with a rest day in between. For example, Monday, Wednesday and Friday. Do the movements in a smooth, slow, steady manner. Take about 3 seconds up and 3 seconds down. None of the exercises should be painful to perform. Rest as much as you need between each of the different exercises. Try not to hold your breath during the exercises. Be flexible. If you're feeling unwell or have a busy day with appointments and commitments, be prepared to do your exercises on another day. Each exercise is repeated up to 8 times in a row. This is called a set. To get started, try 4 repetitions of each exercise, but aim to build up to 2 sets of 8 repetitions with a break of about 20 to 30 seconds between the 2 sets. Where an exercise uses free weights, start off with half a kilogram dumbbell or ankle weight. When a movement is no longer challenging and you're managing 2 sets of 8 repetitions in a slow, controlled way, you're ready to increase the free weight by another half a kilogram. Remember, each movement should take about 3 seconds to do the movement and 3 seconds to come back.
Chapter 3, Practical Exercise Techniques.
Exercise 1, sit to stand. This is a good exercise to warm up the leg muscles, and it helps to strengthen the hips, knees and ankles. Start in a seated position on a kitchen chair. A couch or recliner is generally too low. Your knees should be bent and feet flat on the floor and a little apart. Move your bottom forward on the chair and bring your feet back towards the chair legs. If you can, cross your arms in front to keep them out of the way, so you just use your legs for this exercise. Alternately, you can use your hands to push up from the chair if you need to, but try and make your legs do most of the work. Move your head and shoulders forward over your knees and push through your legs to stand up in slow motion, taking 3 seconds. Feel the chair with the back of your knees or reach for the seat with your hands to make sure the chair hasn't moved. Slowly bend your hips and knees to lower back down into the chair, taking 3 seconds. This really works the muscles. Do up to 8 repetitions to complete the first set. Up, 2, 3. Down, 2, 3. Up, 2, 3. And down, 2, 3. Up again, 2, 3. And down, 2, 3. Up, 2, 3. And down, 2, 3. Up, 2, 3. And down, 2, 3. Up, 2, 3. And down, 2, 3. Rest to allow your thigh muscles to lose any feeling of muscle fatigue before starting on the second set. This might take 20 or 30 seconds between the sets. Now for set 2. Up, 2, 3, and down, 2, 3. Up, 2, 3, and down, 2, 3. Up, 2, 3, and down, 2, 3. Up, 2, 3, down, 2, 3. Number 5, up, 2, 3, down, 2, 3. Number 6, up, 2, 3, down, 2, 3. 7, up, 2, 3, down, 2, 3. Last one, up, 2, 3, and down, 2, 3. Exercise 2, knee extension. This exercise helps to strengthen the muscles around your knees and helps with mobility. Put the weights on your ankles. Sit in a chair with your bottom well back to allow good support for your thighs. A deeper chair is better here. You're going to take 3 seconds to lift one foot off the floor, straightening the knee as much as possible. Then slowly with control, lower that foot down again to bend the knee. Repeat this up to 8 times for your first set. Up, 2, 3, and down, 2, 3. Up, 2, 3, and down, 2, 3. Up, 2, 3, down, 2, 3. Aiming for nice, smooth movements. Down, 2, 3. And up, 2, 3. Down, 2, 3. Last one of this set. Nice and smooth, slowly down. Very good. Now the next leg can do its first set. Up slowly and slowly down. Up, 2, 3, and down, 2, 3. Up, 2, 3, and down, 2, 3. Up nice and smoothly and down nice and smoothly. Up and slowly down. Up, 2, 3, and down again. And up and slowly down. And last one of this set, and slowly down. Now your first leg will be ready for its second set. Just wait till all that muscle tiredness settles and off you go. Up, 2, 3, down, 2, 3. Up, 2, 3, and slowly down. Up slowly and down slowly. Slowly up again and nice and smooth down. You're doing really well. Slowly down. Up, 2, 3, and down, 2, 3. Last one of this set. And down. Very good. Now the other leg, its second set. Off you go. Up and slowly down, keeping as smooth and controlled as you can. That's it. Up and slowly down. And up and slowly down. Sometimes you'll notice a bit of jerking in the muscle. As long as you can keep it reasonably smooth, you're doing well. Up and slowly down. And up and down, 2, 3, and up and down. Very good. That's the end of the second set of both legs. Those thighs will be really feeling like they've worked. Exercise 3, side hip raise. This exercise helps with walking and balance. It's easy to cheat in this exercise, so watch your technique. Put the weights on your ankles, stand behind a tall chair or near the kitchen bench and hold on for balance. Keep your bottom tucked in and your feet pointing forwards as you slowly lift one leg out to the side. You pause there and then slowly bring that leg down again, taking about 3 seconds both directions. Watch you don't tilt your body as you move that leg out. So out, 2, 3, and slowly back. And out, 2, 3, back again. And out. That's it, slowly back down. Out. And slowly down. 1, 2, 3, back, 2, 3. And out, 2, 3, and back again. Have a little bit of a rest between the different sides and turn around and get the other leg ready to start. Watch that you don't tilt your body as you move that leg out. You can do up to 8 on one leg and then the other, or you can do alternate legs. Off we go, out and slowly back down again. And number 2, slowly down. 3 and down. Out, 2, 3, back. Out, 2, 3 and back down again. Out, 2, 3 and slowly down. And out, 2, 3 and slowly down. And out, 2, 3 and slowly down. Well done, that's your 8 finished. Turn around to face the other way. Just wriggle your hips a little bit and your legs before you get ready to start on that second set. Make sure those hips are ready and you feel like the muscles aren't too uncomfortable. Out, 2, 3, back, 2, 3. Out, 2, 3 and back again. And out, 2, 3 and down, 2, 3. Out, 2, 3, back again. This is number 5. And slowly down. Number 6. And slowly back. Number 7. Slowly down. And 8. And slowly down. Good. Give yourself a little rest before you do the second set on the second leg. This is quite a strenuous exercise, so make sure you take the time you need between. Out, 2, 3 and back again. Out slowly and down. Number 3. And slowly down. Out, 2, 3, back, 2, 3, out, 2, 3, and back, 2, 3, out, 2, 3, and down. Couple more. That's it. And slowly down. And out, 2, 3, and slowly down. Well done. That's the side hip raise finished. Exercise 4, toe raise. This exercise uses your own body weight as its resistance. Stand behind a tall chair or come to the kitchen bench and hold on to it for balance and safety. You're going to take 3 seconds to lift both heels up as high as possible and stand up on your tiptoes. Hold this position for about 3 seconds, then slowly lower back down. Okay, off we go again. So up, 2, 3, stay up there, 2, 3, and slowly down. Up, 2, 3, stay up there, then slowly lower down. Up, 2, 3, pause, 2, 3, down again. Up, nice and smooth, stay up there to make the calf work, and slowly down. Up, 2, 3, pause up there, and slowly lower down. Keep going to make those calves work hard. Slowly lower down again. And last one of the first set, up slowly, pause, and then slowly down. After you've done the first set, just move around for a little while, move your feet, Give the feet and the calves a little bit of a shake and bend at the knees if you need to. And when your calves are feeling rested and ready, you can start the second set. Get yourself into a comfortable position and up you go. Pause as you push up there and then slowly lower down. 1. Number 2, up slowly, pause and slowly down. Up again, pause for 3 seconds and slowly down. Up, pause it there and then slowly down. Up, 2, 3, pause, 2, 3, slowly down. Pushing up, pause with the heels up and then slowly lower them down. Push up again, pause and slowly lower down. Nearly finished. Pushing up, pause up there and slowly lower down again. And then let those calf muscles have a rest. Well done. Exercise 5, overhead arm raise. This exercise helps to strengthen your shoulders and upper arms. You can do this movement in sitting or in standing. First of all, hold on to your dumbbell weights. Your arms are going to bend at the elbows with your palms at shoulder height, facing out. Slowly taking 3 seconds, push your hands upwards towards the ceiling, straightening both elbows. Take 3 seconds again to slowly bend at the elbows and bring the hands back to shoulder height. Up, 2, 3, and down, 2, 3. 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 Up, 2, 3, and down again. Nice and smooth and with control. Up, 2, 3, and down, 2, 3. After you've done that first set, let your shoulders and arms have a rest. If you have a sore shoulder, you may choose to do this exercise one arm at a time, moving just the sore shoulder only within its comfortable range. When your shoulders and arms are feeling rested, you can begin your second set. You might need 20 to 30 seconds to rest. Here we go. Second set. Up, 2, 3, and slowly down again. Number 2. Up, slowly, and down again. Number 3. Up, nice and smooth, and down again. And up, and down. Number 5. Up, 2, 3, and down, 2, 3. And up, 2, 3, and down, 2, 3. And up, and slowly down. Last one. Up, and slowly down. Well done. That's 2 sets. Let your shoulders shrug a little bit, loosen up the muscles that have been working. Exercise 6 is biceps curl. This exercise can be done sitting or standing. but you need a chair without arms if you're sitting. Take hold of your dumbbell weights and start with your arms hanging comfortably at your side. Slowly bend the elbows, bringing the hands up towards your shoulders, and slowly lower them down again. Keep that nice smooth control. Up, 2, 3, and down, 2, 3, and up, 2, 3, and down, 2, 3. So we're not moving the shoulder, just the elbows. Up, 2, 3, and down, 2, 3, and up, 2, 3, and down, 2, 3, and up, 2, 3, and down, 2, 3. Last one of the first set, nice and slow and smooth. When you've done one set, just let those arms rest for a short time. You might put your hands on your lap and wriggle your shoulders a little bit. Just let the biceps muscles settle. If there's any sign of fatigue, let that fatigue or aching feeling settle down before you start the second set. Bring your arms down to your side again, and second set can start. Up slowly, down slowly, and up, 2, 3, down, 2, 3, up, slow and smooth, down again, up, nice and smooth, down, nice and controlled, up, 2, 3, down, 2, 3. This is number 6 if you're counting, and slowly down. You're doing up to 8 in a set. 7, slowly down. Number 8, the last one of this set, and slowly down again. Bring the hands back, rest them on your lap, wriggle those shoulders and arms around. Give your hands a shake if you need to.
Chapter 4, Functional Exercise Techniques.
I work as an occupational therapist in a community health setting, and I will talk to you today about the use of functional activities around the home as a means of exercise. If you find for some reason that you cannot complete the resistance exercises discussed in Chapter 3, then you may wish to consider modifying daily or functional tasks to gain a similar effect. Ideally, these tasks should be used to supplement the resistance exercise and not to replace it. And again, keep in mind your slow, steady movement. Exercise 1 in Chapter 3 was the sit to stand exercise. This exercise can be incorporated easily into your daily life by taking time to do stands from your dining chair, lounge, outdoor furniture, or even your toilet. Exercise 2 focused on knee extension. Why not lift a small plant pot with your feet while sitting reading the newspaper? Exercise 3 was side hip raises. How about incorporating this into your cooking while standing at the bench top, or while doing the dishes, or while putting the shopping away? Exercise 4 concentrated on toe raises. Why not incorporate this into pruning high plants, putting items of shopping away, or hanging washing on the line? Exercise 5 focused on overhead arm raises. How about incorporating this into hanging out the washing, lifting pot plants onto shelves, or lifting food items into higher cupboards? Exercise 6 was the biceps curl. How about lifting your shopping bag into the car, lifting a kettle, or lifting a watering can while gardening? So as you can see, the prescribed exercises can be incorporated into your daily activities or ideally used alongside the exercise program. If you have any queries regarding using functional activities as exercise, please contact your occupational therapist or physiotherapist.
Chapter 5, Client Stories.
Hi, I'm Brian Smith. I've had 5 cancers with bowel, 2 kidneys, liver, and now the prostate that I'm going through right now.
My name is Jill and I have multiple sclerosis. I was diagnosed in 2001. In 2005 I had a bad fall, broke both my wrists, which was very debilitating. After that things seemed to go downhill. Lots of fatigue, I was falling asleep a lot during the day, and I really felt that I needed to do something about my life because quality of life was very poor, very difficult to do things.
My name is Peter. I was diagnosed in 2007 with very aggressive prostate cancer, which had spread to many parts of the bone in the body. Hormone treatment controlled it until 2010, when I had 6 doses of chemo, which controlled it again until the beginning of this year, and I'm halfway through another 6 doses of chemo.
The resistance and weights exercises I've been doing for about 12 months, I would say. I started having physio. I've had physio most of the time, but not specifically weights. I have an angle towards balance and stamina exercises because those are my main problems.
Yep, I have mobility and look forward to the exercises because it's, that's something to do and it's beneficial. The nutritional side, with chemo you have no desire for food at all, so it's been very beneficial for myself and my wife, Kira, to go through the nutritional advice and say, oh yeah, I might try that, so it's worked very well.
Well, the nutritional advice, I've certainly changed the way that I eat. I have far less carbohydrate, much more protein, and I'll drink 2 litres of water a day and have the oil capsules. Now, having the oil capsules, I think, really started off a difference in my quality of life, and it began to give me more stamina so that I could do the exercises. I actually have lost weight and I'm sparking, as I said to my neurologist the last time I saw him. It's just changed my whole way of living.
Well, the nutritional and the advice has been enormous for me as far as things have been going through my cancer experience, and it's been really essential. Everybody should be doing it that's actually had this problem. I don't call it a disease, I call it a problem. So, it's been excellent.
By managing your diet and exercise following this programme, you will be able to better manage your health. For Peter, Brian and Jill, implementing this programme has meant they have been able to take more control of their health issues, leading to an improved quality of life. If at any time you are experiencing difficulties with this programme, please contact your local health service provider.